another edition of the program Addiction and Recovery. I'm your moderator this morning, Jason Kalu. Happy Thursday to each and every one of you. Join me as we welcome the host to the program Addiction and Recovery, Mr. Ramnaris Dwaraka. Sitaram to you, sir.
I'm Jason, and thank you for having me on the program this morning again. It's a little bit bleak outside, but this is the rainy season. And let me join you in welcoming all our listeners, both here in Trinidad and Tobago and worldwide. I also want to reach out to all those people who may have been affected by the adverse weather conditions and to let them know that, our prayers are with them and our support. Jason, as a result of this program, I have received so many calls over the last week, especially from mothers who have adults, children, sons in particular, who are drinking and, people who have good jobs and well employed and all of that, yet they seem not to have any control over their drinking. And, mothers in particular, they have a special attachment to their sons, especially. And although the fathers would, sometimes be able to put down their foot and, draw the line and be tough and all of that, sons always have a way of being able to manipulate their mothers. There's always a soft spot there. And as a result, these mothers suffer because they love their children. Fathers love their children as well. And sometimes the children are oblivious to the hurt that they are causing. Because when you become an adult, especially when you have aged parents, Jason, they look to you. There's a saying, once a man, twice a child. Well, the same thing we do for our children in a kind of way without demanding it. We kind of expect that there's a moral responsibility on part of children to take care of their parents, especially when they're getting down in age. Parents, look forward to that. But unfortunately, and I'm not blaming here, because we do understand that alcoholism and drug addiction is a disease. But because of being afflicted with this disease, children sometimes or very often are unable to deliver that moral responsibility. Rather than that, they become a source of, pain and suffering for the parents. I have heard so many stories over the last over 40 years that I'm working in this field, and I know I'm a parent myself. And of course, being a person in recovery, I also now recollect how my parents would have been, hurting because of my own behavior. Because today I know if my son is here and he goes out with friends in the evening, I have a difficulty going to sleep until he comes back. And I know this is true for a lot of other parents out there, you know, and then it is actually like torture because you sit there and you're waiting and you hear a car pull up and you think it's your son coming home. You go through that sigh of relief only to find it's not him, it's somebody else. And sometimes they bring a message, and not a pleasant one, that he might have been involved in an accident or he's in the cell and you need to now rush, get your papers, go see you're looking after bail for him, get a lawyer or justice of the peace. I have seen all of these scenarios play out. And in the normal course of things, we all seem to think that, look, that will happen with everybody else. And even though death is inevitable, people don't even think that they are going to die one day either. Everybody else is going to die. But these are realities because once you keep drinking or using drugs, it's just a question of time. And to all of our brothers and sisters who are listening to this program, who may be social drinkers at this stage, and let me say up front, this station, this media house, and if I could speak on behalf of it, we have no problem with people who can take a drink and enjoy it. We are not about drying up the world, but we are about educating our brothers and sisters into making the right choices. And you out there listening, you have to be honest, especially with yourself. this morning as you listen to this program and you're taking a drink socially, you're enjoying it. But have there been times, where you went overboard? And I have been posting these programs on YouTube. All you have to do is to put in my name, Ramnaresh Dwarika, and you will be able to access them. There are programs there that will help you to determine whether you're an alcoholic or drug addict. And if so, what are the resources available worldwide, and especially here in Trinidad, that you could access and get help. And for anyone who having difficulty, of course, this is an interactive program. I encourage you to call the program. You have questions, you can call and ask. The numbers are going to be up on the screen. Or you can call me after the program as well. I'd be only too happy to share whatever information with you. And we are very fortunate that we do have a reasonable amount of resources in this country. And in the developed world, it is even better where you can access treatment. So this morning, I thought, Jason, we will talk a little bit about the barriers to treatment. Because I heard the cries of frustration from these people who spoke to me during the week, and the challenges, the difficulties they're having to get their children, their siblings to seek help. And one of the biggest barriers is the stigma associated with substance abuse and drug addiction. In spite of all the education, in spite of the programs we have been doing, still the larger part of the population worldwide, and here in Trinidad and Tobago as well, they still think it's a moral issue. They still think it's a question of will. That all you have to do is make up your mind and use your intellect, your willpower, not realizing that this is one disease. Alcoholism and drug addiction is a disease so recognized by the World Health Authority, even by our health department here. And it is a disease that is cunning, baffling, and powerful. And it seems as though the person to realize it the last would be the person who is suffering with the disease themselves because of the denial, because of the stigma associated with it. Nobody wants to admit that they have a problem with alcohol or drugs. And I speak here from experience, Jason. For years I suffered, and my family suffered as well, because I did not want to ever admit, even though all the evidence was up on the wall, all the signs were there. I knew I had a problem with drinking, but you see, here's another insight I would like to share with our brothers and sisters out there. And that is, we have been socialized by our parents, by our communities, to become self-sufficient. We all strive for independence. You remember when you were small, Jason, your mother would say, or your father would say, or somebody, boy, you're old enough now to go and take a shower, You're old enough, you're old enough, to get dressed, to comb your hair. And so progressively we became more and more independent of our parents and our siblings and our community to some extent, and we pride ourselves on being able to be self-sufficient. So that when the problem of addiction comes around, and because of the stigma associated with it, we all, and I did, in fact, try to fix this problem myself. I would have liked to, because of my ego, to be able to knock my chest, as we say, and say, look, I was able to stop. And I have had friends and people who come to me, clients as well, who say, look, I have been able to do this on my own. And hats off to these people. There are some individuals I know who, because of some reason, some incident, some crisis sometimes, decided, look, this is it, I am going to stop. And they were able to. However, Stopping drinking, I might hasten to add, is not necessarily sobriety. What you have there is abstinence. Sobriety is something else, and we'll, time permitting, we'll speak about that if later on in the program. But coming back to what are the barriers to treatment, why so many people don't want to go out and get help, is because of the stigma associated with it. I know so many people, Jason, who would eventually, when they came for treatment, their families will tell the people in the community, who saw that they were missing for a few days, the friends and the neighbors, that they went for holiday. They would never want to admit that, look, they went for treatment at Cora Hospital or substance abuse. Worse off, and this is another barrier, where in some countries, in some societies, and indeed in Trinidad here as well, the treatment facility was located at the psychiatric hospital in St. Anne's. And nobody ever wanted to be known in their community to have had to visit St. Anne's or had to be housed there, because the first impression everyone will get is that you were mentally ill. And I'm sure you're familiar with this, Jason, in Trinidad. When a person goes to St. Anne's and they come back, sometimes they themselves boast that, look, I have my papers now, meaning that they can do any crime and they will not be held responsible. They threaten people with that, that I could do anything now because I have my papers. I am certified as mentally ill. And we know in law, if you're mentally ill, you most of the time you will not be held responsible for whatever crime you commit. But so on the other side, the converse to that is a lot of people never wanted to go there. And thanks to people like Professor Berbrand and Dr. Lewis, they were able, the Ministry of Health moved the treatment facility from St. Anne's Mental Hospital to Cora Hospital way back in the 1980s. But even so, still you have people who do not want. They go there eventually, but they don't want anybody to know. They say they went on holidays, and when they come back uh, to their communities, for the same reason, they do not want to go to AA meetings, even though it's just a stone's throw from where they are living, because they don't want people in the community to know that they have a problem with alcohol or other substances. Again, so it's the stigma. And although we are blessed with so many resources here, not many people would like to use it. Now, as I say resources, I don't want to convey the impression that they are adequate. No, by no means, because in Trinidad and Tobago, if you're under 18 years of age and you have a substance abuse disorder, there's still no place for you, because the center we have, substance abuse treatment center at Cora Hospital, is really for adults. All the other treatment facilities are for adults. They do not cater for children. And that is not to say that children are not becoming addicted. From the research here, we know that most of the people who became addicted to marijuana and cocaine and these hard drugs, they were addicted long before they were 18 years of age. All from 13, 14, 15, they were using it. A research that I was part of way back in the 1980s, done in primary schools, showed that by age 9, 10, a large proportion of primary school students had already been introduced to alcohol by their own family members. Because we live in a society where our children are learning every day that the way to celebrate, the way to entertain, the way to mourn, the way to do almost anything to party, socialize, is to have alcohol on the scene. You know that, Jason. That's a lifestyle here in Trinidad. We don't have to look for reasons to drink. And we are teaching our children the same thing. They grow up with this mindset that that's the way to entertain, that's the way to have a good time. We see all the leaders doing this, the people we look up to. Of course, I'm not including our pundits here, but I'm talking about the other people. Now, there's the stigma, but there's also the shortage of resources, as I'm speaking about. Because
Mm.
if you go to the National Drug Treatment Center at Cora Hospital, and this holds true for a lot of places, especially in the third world, Jason, there are a lack of resources. I studied in Jamaica, and in a large place, Jamaica, that has about several times the size of Trinidad, and the population. In 1983, when I studied at the university there, they only had 5 AA groups when we had over 100 in Trinidad, notwithstanding our small size. And there was not any appropriate drug treatment facility there. Substance abusers had to go to the psychiatric unit at Ward 21 at that time. Indeed, it was happening here in Trinidad as well, and with the stigma associated. So that there had been and there still continue to be a lack of resources in Trinidad. So that people who go to the substance abuse unit are normally put on a waiting list for admission because there's only so many people they can take.
Mm.
And I would want to speak to that issue because it is not every day, Jason, that a drug addict or an alcoholic gets up and decide, look, you know what? I need to do something about my drinking or my drug use. You know, from our earlier conversation, we realize how difficult it is to get someone to admit and to decide to do that. And can you imagine now when they eventually agree, they don't have no place to go. The center doesn't have any place to keep them. Well, I want to thank God that we do have some non-governmental organizations in Trinidad, like the Heal House, like Rebirth House, like New Life Ministries, that have been picking up the slack. But you know, even they don't have a ready accommodation available. If an addict said, "Look, today I need to go get help," and it is one of the reasons I started this private practice when I was working at Cora Hospital, because I know from being a person in recovery myself that, listen, if you miss that opportunity, that window of opportunity, when that alcoholic or drug addict says, look, I will go to see someone about my drinking or drug use, you would have probably lost an opportunity to save that person's life. It is as serious as that because that opportunity may never come back. And I'm saying this so that our policymakers will be aware that we need to have these facilities. You know, we do have, this is not about being critical, but you know, some of the other barriers, and indeed in this program, we'll never be able to cover all the barriers. Let me say it up front. There is the problem with people who go to hospitals. They drunk, they fell down and they broke their arm, or they drunk and they got into accident with a vehicle. They shows up at the emergency department and they get diagnosed for a broken arm, or they get diagnosed with multiple injuries to the body, lacerations. Nothing is ever put, no diagnosis. The root cause of the problem was the alcoholism or the drug use, but that is not listed as a diagnosis. And I know that is true in Trinidad as well as when I did my research in Jamaica. My research paper, my thesis was on alcoholism in Jamaica. And I went to the hospitals at UC and downtown. And you would think Jamaica don't have a problem with alcoholism because there were not very few instances of anything recorded about the person's alcoholism. Yeah, you saw the broken arm and the vehicle accident and all of that, but you never see any record. So we really, and this is why when we look at statistics, Jason, we are only seeing the tip of the iceberg, you know, because we go and look at it from the other end. We go to treatment facilities and we pick up on the statistics of people who came for treatment. But from all that we have talked about before, we know out of 10, sometimes one, sometimes we would want to even say out of 100, only one might agree to go for treatment. The rest of them, in fact, I have some statistics here that was taken from a US study. And it's saying some of the barriers for treatment, Jason. It says 39% do not go because they can't afford it. You know, they don't have health insurance. Well, that goes for the United States. Then 29% of them were never ready to stop, and that's a popular one. Maybe later on I'll stop, not right now, man. And then 18%, they were fearful of the negative opinion from neighbors and the community. And that's what we were talking about earlier on. There's a sizable proportion of people. And some of them who they can't afford it and they're not ready to stop are also concerned about this. So they are also in those other percentages. Then 17% are afraid it would affect their job. They don't want to lose their work. They don't want the boss to know. So they're not going for treatment because they'll have to go for 6 weeks. Is one of the shortest treatment in Trinidad is 6 weeks. Then 14% did not know where to find help. And you'd be surprised. Even in Felicity here, I lived for so long and I did not know that there were an AA group right up the road. You understand? So that we're not aware. And 8% did not think they needed help at all. You understand? And that's a straight case of denial. Now, there's also the question of inadequate, even in these treatment facilities, the non-governmental organizations, a lot of them don't have a doctor on board, standby in the center. They have to depend on the health facilities to screen their clients. And it is imperative before a person go into a treatment facility, Jason, they must be screened because you don't want a person coming into your population of people in the facility who may be infectious with, say, tuberculosis or some one of these, or even COVID. No, because they can throw your whole program under the bus because of their illness. So you need to be able to send these people somewhere and have treatment, be screened. As I say this, having worked at the Substance Abuse Prevention and Treatment Center, I really would like to commend that for people in Trinidad and Tobago as one of the gold standard in terms of treatment, because there's a team of trained professionals there. You have a consultant, psychiatrist, you have house officers, you have trained psychiatric nurses, mental health officers, psychologists, social workers, a team. So that when a person goes there, they are thoroughly screened, not only because, alcoholics and drug addicts, Jason, they live very careless. Because of the nature of the illness, they engage in a lot of risky behaviors. They can pick up with sexually transmitted diseases and all kinds of other illnesses and so on. So you want to make sure that they're not only going to stop their drinking, but they also going to be able to deal with their other health issues. So that I know that the NGOs, they also do that. They send their people before admission to the local health centers. I remember when I was at Piparo, we would send our people there to Gasparilla to have them screened, because even though it was a government facilities, we did not have sufficient work to have a full-time medical officer on board, but we did have a nurse, So that is, you have a lot of facilities, but they are inadequately staffed. As I say this too, I know that a lot of the facilities, Jason, they have a tendency to recruit people who are in recovery. And that is definitely an advantage, because a person who is in recovery is best able to empathize with their client population because they have been there, they've done that. They are literally experts in the field of denial and all of that. They would be able to recognize the difficulties that the client, the new person is having, who is now being admitted. However, there is one proviso there, a word of caution though, because experience is not a substitute for training. that some of these people, I have had the 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 um the experience of working and visiting centers where people are, they employ a lot of people. In fact, when I was the director at Piparo, I employed most of my staff were people who were in recovery. That is the clinical staff. And but they were also people who were trained. Most of them went to the certificate in addiction studies program, where I also was a lecturer at one time and had the trainings. Because when you put training and experience together, it is the best combination. I have seen people with the best of intentions do do quite a bit of damage because they don't realize, because they were not trained. There's several studies done on that. So at the same time, I don't want to detract from the valuable service that these non-governmental organizations are really offering to this society. Worldwide, historically, the non-governmental organizations, these are the groups that have come forward and filled the void in fact, social work, for which I am trained, when it did start in England. Was started by social workers, by community people, not by government. Eventually, governments see the need and the usefulness of these programs and eventually adopt it. In fact, a good example is the Mahasabha in education, who went out there. Can you imagine for a minute, Jason, if the Mahasabha had not gone and built all these cowsheds, as they were called, I would not have had a school to go to in Devi, the Devi Hindu school. Sometimes we take these things for granted, but look at the service these organizations are doing, the various denominational boards in the field of education, and so too in the field of substance abuse, these non-governmental organizations, and these should be properly funded. Government should insist on assisting because you're getting a group of people to do what you should be doing, what taxpayers are paying you for, and they're doing it on their own volition, using, voluntary service to do that. A lot of these people, I've belonged to so many organizations where you don't get any pay. And on top of that, you do get a lot of abuse as well. You know, your criticism sometimes is your lot, as they say. Coming back to the barriers though, and this one I want to make sure I speak about it, you know, is especially where women are concerned. The stigma associated to alcoholism and drug use is so far different for men than for women. A colleague of mine, Dr. Reed, did a among medical students, and she asked them to describe, profile an alcoholic and drug addict who was a male alcoholic and drug addict, and they would say bong to drunk and skid row and bum and things like that. When the same students were asked to describe female alcoholics and drug addicts, their description was very, very derogatory, sketel and prostitute and things like that. You understand? And so for that, women know this. This is why women have been, for the large part, closet drinkers. They drink wine and they take and some of them go on prescription pills to help them to cope. And a lot of times it is to cope with an alcoholic husband. You understand? And it is so easy. The woman has made it, an art of taking care of the house. In spite of the alcoholic going out there, not bringing any money, spending it out, coming and abusing her and the children, she still holds the family together. So that he eventually, when for some reason he decides to go for treatment, he can go. He can go for as long as it takes and get his treatment, get his act together, and he can come back and with some help, the family can be reintegrated and be rehabilitated. But think, when the shoe is on the other foot. If it is the woman who has the problem, not many men will leave the job and stay home to take care of the children and they do the laundry and cook the food and clean the house so that she could go and get help. I want us to wrap our mind around that for a minute and think. So women are really shortchanged. And for crying out loud, you don't even have sufficient facilities in Trinidad and Tobago and worldwide for women, because a lot of women, even when they brace themselves and develop the courage and determination, and if you have to go into a center that is predominantly male, you have other challenges there. I have worked in treatment facilities, that are male, female, and there's a whole lot of new dynamics that takes place there because the male patients in recovery, they're always trying to, flirt with the females. And some of the females, because of their low self-esteem, they forget their program and they are more interested in these approaches now. They like the attention, and it is a whole mess. Rehabilitation and the program goes haywire, and the staff is now preoccupied how to keep these people from each other. So it is a sigh of relief that in Trinidad we have had one or two treatment facilities that are predominantly for female. I know the New Life Ministry started one at Santa Flora, and I really like to commend them for that. And there's a colleague of mine, Beverly Mawson, who is struggling to keep one going at Auckland Village, Serenity Place for women, drug addicts, and doing a marvelous job. And we need to really recognize the work that these people are doing, the effort they're making. And with the limited, sometimes no resources at all, they beg, they do all kinds of things, to keep these facilities going. So that in itself, the shortage of resources, treatment facilities, stigma associated with them, the lack of childcare services to pick up so that women could go and do something about their substance abuse is almost absent in this country.
But in terms of females and children under the age of 18, in terms of using the online meetings, they remain unanimous. Their identity is not shown. Their video pictures are not shown. They can also change their names. Has online actually helped in terms of those barriers?
I am so happy that you're asking that question, Jason, because that is a life savior. If it's the one good thing that has come out of this pandemic, it is the online meetings that have now become available. And I can tell you, I do jump into them to observe sometimes what's happening and all of that. And I know that a lot of women are now coming forward because they don't have to put their picture, they don't have to put their name, they just have to. And as I speak, I want to invite all of the world, because there are meetings now being held right here in Trinidad. There's a online AA group called the Circle of Reflection online AA group. In fact, anyone listening out there, all you have to do is to go on your phone and Google AA online meetings. And you will see that there are several, in fact, right now, there are several physical meetings that are registered on that website. I have been actively recommending it to people who are interested in recovery. And there are online meetings that you can access not only here in Trinidad, but worldwide, any time of the day, night and day, 24-hour meetings. And of course, there's the one in Trinidad, yes, Circle of Reflection, online AA group that has meetings every evening at 7 o'clock. The meetings go from 7 to 8:30. And anyone interested, if you go on that, you could download that app. It's available in the App Store, AA online meetings. And all you have to do is hit the app and you're coming to the meeting. You don't even have to put a password and an ID number anymore. You can access the meeting. And as I said, you don't have to put your face. You don't have to put your right name. Some people have just their phone, Samsung, they have whatever mnemonic they wish to put. But of course, in meetings, because of the confidential nature, sometimes the chairperson may ask you to identify yourself to them. You can do that in the chat box, or a lot of times friends in a meeting, people who are in recovery, invite other members and vouch for them and said, it's okay, I know this person, I invited them to the meeting. Once it's not hard and fast. The only reason is that, sometimes people try to hack into these meetings now that they are available and disturb the meeting. And that's the only reason, that it's really because some of what is discussed there is highly sensitive information, confidential information. But as I say this too, for people who are attending the meeting, you know, you have the option of having a sponsor, a person you know and you can speak to privately, and you reserve your sensitive information for that person. When anyone who attend meetings, it is suggested that you speak about your experience, strength, and hope in a general way, so that your information is not out there, because the internet is worldwide. It is available, but your identity and your privacy is protected in these Zoom platforms. So that I know I watching the clock on the wall, and I know that when we get into these discussions, I want to quickly talk about, we spoke about access. Not everybody having equal opportunity, women not having equal opportunity to access the meetings. But now with the online platform, there's no excuse. Anyone can have access. So that's a saver. And I spoke about the lack of funding. You know, Now we also have to look at, even though our first line of defense is to go to our doctors and a lot of people they attempt to fix the problem themselves when they have the hangover and all of that. And as I say this, one of a major barrier to seeking help is the withdrawal symptoms. That is to say, a lot of people who, especially alcoholics over the age of 40, or people who have been using alcohol and drugs for a long time, or even prescription pills for a long time, when they stop, the withdrawal symptoms can be very severe. Some people become very depressed. Some people become very anxious, Jason. Some people, they start hallucinating and seeing and hearing things that are not there. They have what you call tactile hallucinations. That is, they feel like things crawling all over the skin. People talk about foul louse, that is imaginary. Or hearing voices, people telling them to do this and do that. Now, and because of that, they have learned over time that, look, when I go and take a drink, these things go away. So I'm saying that, yes, the same thing that got you sick can get you better, only to get you back sick again. So yes, if you have a person who is in severe withdrawal and seeing and hearing things and hallucinating, they can become a danger to themselves and other people. So give them a drink, yes, give them a drink quickly and stabilize them. But before that drink wear off, get them to a treatment facility where they will be able to be detoxed under supervision. Now, that, as I say, is one of a big barrier to even the non-governmental organizations, because none of them have the facility to detox anyone. So that the person who gets up this morning and is in withdrawal and wants to stop drinking and has to go either to Ward 1 or Ward 8 of the Port of Spain General Hospital, the emergency department. And that in itself is a barrier, because that is a psychiatric unit. And the first thing you're going to tell they're going to tell the family, I am not mad. I'm not mentally ill. Why are you putting me there? I don't want to go there, because once you go, again, as a professional, one of the worst things that can happen to any human being is that a professional like myself or a psychiatrist put a label on you and say that you have some mental illness. You're schizophrenic or you're bipolar. They have all of these fancy names they fit you into, and then that will follow you for the rest of your life. So a lot of people resist that. They don't want to go to those places, but they know when they stop, there's going to be consequences. And that's one of the reasons I introduced the use of acupuncture, because acupuncture can help you to deal with all the withdrawal symptoms. Except, however, if a person is hallucinating and so on, acupuncture, it would be safer to have them in a safe environment, in a restricted environment, so that there's a lot yet to be desired in terms of the ancillary service, the support services for people who would like to go for treatment. Some people can't get time out from work because they would lose their job. And that is a serious thing. In the world that we live today, you don't want to leave your job to go for treatment because you don't want the people on the job to know. But again, I want to let a lot of people or listeners know out there that we do have employee assistance programs associated to a lot of the ministries and private enterprises in Trinidad and Tobago and worldwide. And these would be the people who you could go to on the job in confidence and let them know, look, I have a problem with alcohol or drugs, and I'd like to do something about it. And they are in the best position to make arrangement with the human resource department to they put the arrangements in place so that you can get help. I, as well, in my private practice here, have worked with a lot of large companies. I worked with what used to be ISCOT, the University of the West Indies. I have done work for the Port Authority, the Airports Authority, and a lot of other companies as an employee assistant consultant, counseling workers with problems, not only alcohol and drug abuse. I also do marital counseling. I do family therapy. So I have been seeing this thing from a lot of different perspectives. Hence my passion for working in this field and doing this program, Jason. And as I said, I look forward to organizations who would like to reach me if they would like me to come and speak to their groups and so on. I would like to, because it is one of the reasons I do this program. I could sit here in my office and talk to one person, and yes, that one person could get help. But on this program, we are able, Jason, to reach people worldwide. And I know that we are reaching people, and I want to thank Radio and TV Jagriti and the management there for for presenting and allowing this program as a community service, because I know you all are not getting paid for this. You understand? You don't have any advertisements again that support these programs. I would like to encourage corporate citizens to get involved in sponsoring programs like this at the radio station, because I know it costs you in terms of staff and time to run programs like this as a community service. So I appeal to corporate citizens. I know a lot of people in the past came forward, like the baking powder company used to sponsor this program in the past, you know, and there have been other sponsors. I would like to encourage people to come forward and explore that possibility of becoming involved. Again, I want to thank you, Jason, for hosting me every Thursday, and joining with me and Francis and all the people in the back who source the information. Very, very beautiful lead up to this program on mindfulness and meditation. I appreciate those things. And, if one person listened today, Jason, our efforts would be justified. And I know I know more than one person is listening. And you all listening out there, you're quite welcome to call the station, call the number on your screen, 671-3040. If you have questions concerning anything that was said on the program, and to know that this program is again aired again tonight at 10 o'clock, and it will be posted in a little while on YouTube, so that you can, at your own convenience, you can sit with your family and listen to this program. For those people who don't want to come for help, who don't think they have a problem, You can encourage them to sit with you in the living room and say, hey, listen to what this man is saying, and use it as a springboard for discussion in the family. Hear what the other people, hear what the children are thinking. Is it making sense? Because if they are defending alcoholism and drug addiction, you need to start paying attention.
Mhm.
So thank you again, Jason, for having me. And
Yes, I know. Always a pleasure to have you on the show as well, and always taking the time to do this show. And like Mr. Dwarka said, help is always readily available, yes, physically and of course at your fingertips. All it takes is that first step. So join us next Thursday for another edition of the program Addiction and Recovery. Until then, see you around.